Hello and welcome back to Stockhead's video conference on biotechs. Next up, we're going to hear from Race Oncology's MD, Phillip Lynch, ASX code RAC.
Hi, it's Phil Lynch. I'm the CEO and Managing Director of Race Oncology, and I look forward to giving you an overview of our business and the opportunity ahead. I'd like to give you a corporate snapshot before we start to talk about strategy and give you an overview of our business. We've got 143 million shares on issue. Recently, we did a capital raise, raising $5.4 million in May. So with cash on hand at quarter end March, that's about $12 million cash. But importantly, we issued bonus options to holders of record in that month. So what that means is that we raised at $3, we issued options at $4.50. Those options have the opportunity to be exercised within 12 months. And if they are exercised, we have potential capital inflows of $30 million. So that's a reward for existing and legacy shareholders, but importantly, a source of capital for us going forward. Our enterprise value is around $525 million. And I should mention our significant shareholders, Daniel Tillett, our Chief Scientific Officer and Exec Director, our founder, Bill Garner, and Merchant Opportunity Fund from Perth. So that's just a quick overview of our business. But I think more importantly for you, let me talk you through our drug, the team, and the three-pillar strategy that we call our three heroes. Starting with the drug, Byzantine, in fact, is a drug that we're bringing back to market. It was developed in the 1980s by a company called the Durrell Laboratories. It's got a clinical trial history which is rich in respect of the number of trials and the number of patients it's touched, but importantly in its clinical efficacy and safety demonstrated in leukemia, breast and ovarian cancer. In fact, the drug was approved in France for AML back in 1990. And of course, you may then say, well, why isn't the drug in market? Because the drug today is not in market. Rather, it's in a continued clinical trial phase. And that's because the drug was then lost through divestitures and acquisitions of various companies and deprioritized in spite of its fairly rich clinical history. So what we've done in reacquiring the rights to Byzantine, we've manufactured the drug, we've added additional patents out of the US, we've got US orphan drug designation, and so by doing that, we're enriching the opportunity for the drug. But importantly, I would say about the drug, we've de-risked our business to a large degree because we're not developing the drug, it's developed. And it's got good clinical history. Rather, we're executing a clinical trial program that will demonstrate its relevance today and in the future. So let me talk about that future, and I'll talk about it in recent history. And this slide's tasked or called, 2020 to 21, a pivotal period, because if I go back 12 months in June 2020, we reported a 40% response rate in a phase 2 trial in acute myeloid leukemia. From Israel. That's a significant result, but importantly, it demonstrates that our drug is relevant today in a contemporary clinical setting. Also in June 2020, we announced that Byzantine, our drug, was highlighted as the most potent inhibitor of a protein called FTO. And we're going to come back and talk about that in a few slides, simply because that inhibitor, FTO, is important to how cancer develops and is managed. And as you'll see shortly, our ability to inhibit FTO will be, we hope, very important to inhibiting cancer. And we also had some good clinical results, preclinical, I should say, in breast cancer, demonstrating activity in treatment-resistant cells. We added Professor Jianjun Chen of the City of Hope to our scientific advisory board. He's a professor that was cited in the paper I mentioned in June 2020, Cancer Cell, noting the importance of FTO, but from our perspective, the importance of Byzantine as the most potent inhibitor of FTO. So we've got him involved in our scientific advisory board, and that will help us to develop our programs. Finally, in June, we've announced 2 trials, one in Israel, which is a phase 2 trial in AML, and secondly, a trial that'll start in Australia, phase 2, in the extramedullary form of AML. And those trials are both designed to help us progress towards a registration that would allow us to sell our drug in the US market. Our board, and this is talking about our team, I've got a background in consumer health with Johnson & Johnson. My colleague Daniel Tillett, Dr. Daniel Tillett, our Chief Scientific Officer, runs his own business called Nucleics. They're a genomic sequencing company. Daniel's a scientist and very capable, and is an investor, I should say, and is our largest investor, in fact. So Daniel's invested in the business, continues to, and is being a key driver of our pursuit of FTO as an opportunity. Dr. John Cullity, our non-exec chairman, has a pharma background, is New York-based, and has a deal background working with Terea, who are a noted deal maker in the US, working to sell companies like ours to pharmaceutical companies, which I'll touch on shortly. We've got a lean management structure. I would simply highlight that we keep it lean deliberately, and we instead work with an extended team that I'm now showing you on this slide. That extended team means that we can access expertise globally, functionally, and I'll highlight again Professor Junjun Chen joining us from the City of Hope as a scientific advisor. So let me now talk about strategy, and strategy is important. We launched the 3-pillar strategy in November of last year at our AGM. We did so based upon us building on the FTO findings that were highlighted in the City of Hope paper. But our strategy is framed, and I will remind you that our business model is not to create a pharma company. We're not building people and investing large amounts of money in adding people. Rather, we're building and focusing on clinical trial results that demonstrate the utility of Byzantine in targeted indications. And as we generate those results, the value of our drug and our business can be realized through sale to a scaled pharmaceutical company. That's the ambition. The way we're doing that is, number one, through a new focus on pillar 1, the FTO pillar. So FTO stands for the fat, mass, and obesity associated protein that I touched on before. So I'm going to talk in more detail about that. I'll jump to pillar 2. Pillar 2 is our breast cancer pillar. We have legacy results from the 80s and 90s in breast cancer. In fact, a phase 3 trial was ran in the US. It proved efficacy and safety, but we didn't complete the trial successfully. They changed the dosing. But what we have learned about our drug in breast and in other solid tumor oncology is that we're a differentiated anthracycline because we are friendlier to the heart. We cause less heart damage, which offers clinicians the opportunity to use our drug in a chemotherapeutic setting, but in a way that does less damage. So that means we've got opportunity and to build on our breast cancer credentials. Pillar 3 is our extramedullary pillar, or AML pillar. So we've got the 2 trials I mentioned before, one in Israel starting imminently, and the other one in Australia in the extramedullary form of AML. I'll focus in the remaining time on FTO because it's really the value transformational opportunity for our business. Our traditional drug has had credentials in chemotherapeutics, and I mentioned, of course, AML and breast. But in FTO, we have the opportunity for our drug to be relevant to a broad range of solid tumor oncology. So if we look at FTO, it's being discovered and understood over the last 10 years through what's called the M6A RNA methylation as a driver of cancer development. And where you've got changes in M6A RNA methylation, that can control the expression of genes in cancer development and growth. So FTO is one of only 2 M6A RNA demethylase. And what we know is that increases in FTO drive cancer. They impact its development, and they cause treatment resistance and metastasis. So our ability to reduce FTO activity or slow its growth may well prove to be a driver of cancer improvement across solid tumor oncology. So it's a very important area. And if you look at this chart, you'll note that if you look at the middle box, those dots refer to where FTO is present as a protein, in which cancers, And I could simply say in most every cancer is present. And therefore it has an important role in cancer broadly. So our business is pursuing 2 preclinical programs at the moment, one in melanoma and the second in renal cell clear cell carcinoma or kidney disease. Those 2 programs are allowing us to proof of concept that Byzantine has the ability to inhibit FTO in those particular cancers. So we'll do so initially in melanoma. And we think importantly that in melanoma we can address treatment resistance. So in melanoma, many drugs are successful, but many patients are resistant to treatments. And we think that FTO and inhibiting it through Byzantine may address that PD-1 resistance. In clear cell renal cell carcinoma or kidney disease, we think our drug has the ability, again, to inhibit FTO, and FTO in that particular cancer, we think will have the ability to arrest it. So we're demonstrating that preclinically and working through that program now, and later we'll do so clinically. In summary, we do have other programs underway in breast and in AML, as I mentioned, but I really want to highlight in those grey boxes the preclinical programs we have in melanoma, kidney cancer, AML, and our ambitions to progress to a phase 1 FTO program by what's called dose escalation, where we're evaluating lower levels of delivery of the drug that we think will address the FTO levels that I mentioned. And later in 2023 or late 22 going to 23, we can move to a phase 2 FTO program in those 2 indications. I would say, finally, wrapping up, that the beauty of Race Oncology is that we've got a strategy that is rightly focused on FTO. That's a runway or pathway opportunity to creating broad-based opportunity. But equally, because we've got a multi-pillar strategy, we address risk and reward appropriately. So the combination of opportunity, we think, is going to maximize value, but equally reduce risk on the downside. Our team is very lean, very capable, very committed, and importantly, we're rewarded very much on the same way that shareholders are. We'll do well if we have the ability to sell this business at the right value, and that's exactly what we're out to do. So in summary, I'd love to take questions, hear more from you. You can find us on our raceoncology.com website, and look forward to maintaining a dialogue with you, our investors, and we appreciate your support. Thank you.